Hi, and welcome to the Healthcare CEO Show, where you'll find actionable insights on healthcare leadership from the best and brightest in the industry. I'm your host, Daniel Fernandez. Let's get a pulse. With me today, I have Isaac Steg. Isaac is the founder and CEO of Constellation Health Services, a family-owned, family-centered organization providing a range of community-based health services. Year after year, Constellation is recognized as one of the best places to work in all of healthcare and consistently rated in the top 5% of all agencies nationwide by Centers for Medicare and Medicaid Services. The list of awards is both impressive and numerous. And success like this doesn't happen without a successful culture in place. And that is exactly what we're here to talk about today with Isaac. So Isaac, welcome to the show.
Thank you so much. Glad to be here.
Yeah. So what is culture means a little bit something different to everybody. What does culture mean to you?
To me and to our organization, culture is everything. I think early on when we started this company, I recognized the importance of creating the right culture to be successful in whatever you're doing, quite honestly. I think sometimes we tend to CEOs or leaders sit on top and think they're really driving success. And as soon as you can recognize success is directly driven by the employees that you employ, and they really determine the outcome of your organization, I think you're in the driver's seat. It's all about the employees. It's all about the people providing care and touching the patients and the clients. And if you recognize it's not you, it's the actual employees that drive the success of your company, I think that's the first step really to have a successful company and on your way to success.
Wow. So you're almost basically taking that triangular model or hierarchy and just kind of turning it upside down, right? And you're putting almost the employee first.
Absolutely.
Mindset. Do you have a motto, mantra, or slogan that exists at your organization?
Yeah, so we try to sit back and really figure out what we want, how we want our employees to feel. I get up every day. I think I have the best job in the world. I wake up in the morning, I'm excited to come to work. I go to sleep at night and I'm excited that I had a successful day, or, I'm working in this company and building a successful company. And I've always told the leaders and employees, we really need to create an environment where people get up in the morning and they feel excited. And in order to do that, you really have to make sure your employees feel valued, trusted, and heard. If we can accomplish that each and every one of our employees feels valued, trusted, and heard, then they'll get up in the morning and say, I want to come to Constellation. I love my job. I'm happy at what I'm doing. Because ultimately, if they're happy and they're satisfied, it's going to trickle down to your clients. And in order to be successful, your clients need to be happy. In order for your clients to be happy, your employees need to be happy. So we go into every meeting and we think to ourselves, how do we make our employees feel valued, trusted, and heard? And I ask my leaders to really, at the end of every meeting, to think about, did I make our employees feel valued? How did I make our employees feel valued, trusted, and heard? And if you go in with that mindset, 99.9% of the time, you'll be successful, and your employees will never want to leave. And that's the ultimate goal, because turnover is not only a very costly in our business, but it also really employee retention is key.
Yeah. I think one of my favorite things about you is that, and I did a little bit of digging as well, I think a lot of people talk a big game about culture, right? But when I did some digging, I found out that even on Glassdoor, for instance, you have a 100% CEO rating. And that's, it's not a very common thing. So, I mean, I don't know if you knew that or not. Some of the reviews are just absolutely outstanding, and they speak very highly about, yourself and the leadership team. And I think that speaks volumes.
I think we need to show that to my wife too, by the way.
Got it.
But absolutely, I find it very interesting because companies, and specifically in the healthcare space, companies invest so much money into different resources. Mm-hmm. And, whether it's, HR and how to cut costs and, different things. And there are director of recruitment and director of HR and operational directors. And I always found it interesting why don't companies invest more when it comes to employee engagement, employee satisfaction, and building the culture? Usually when you look at company, it usually sits, the HR director or the HR person or the administrator of the program will work with the culture, and they have to buy into the culture, and they're a huge part of that culture, parting culture in trickling down to the rest of your staff. But why don't companies have high level positions that really all they do is focus on making sure employees are satisfied? So I would say about 2.5, 3 years ago, I had made a decision to really hire that position and to really have someone just go around from location to location, work with the employees to find out what's working, what's not working, what we can do better. And really making that investment in that position was huge for us as a company and really helped us, in terms of culture and setting the direction of the company.
And you literally just that leads me perfectly into this next question. How large is the company that you have today? How many employees?
Sure. So we're currently based in the Northeast. We have 600 employees covering 6 states. And Constellation Health Services really covers home-based services from certified home care to hospice care to personal care. We also have a division that focuses on therapy for kids, whether it's providing therapy, so PT, OT services in school districts. We also just recently started a ABA, which focuses on providing autistic services in the community, in the child's home. So we kind of cover many different areas of healthcare.
Got it. And with such a large team that covers the many different aspects, I mean, how do you make sure that the cultural message resonates throughout the team? And I think you just briefly spoke about someone who goes around to visits different locations. Is that one of the ways?
That's definitely one of the ways, but really it starts with myself. I mean, I need to give the direction and really show the entire company how important culture and employee satisfaction is. So and this is something every single meeting we have, we constantly talk about is, what can we do better? Are all our employees happy? And definitely, especially during COVID, there are definitely challenges, but the message has to start on the top and it has to resonate down, and everyone has to buy into it. So you can talk about culture, but if your leadership team doesn't buy into it, it's not going to trickle down. You need to you need to live and breathe culture, and you need to live and breathe that our goal is to make our employees happy.
And speaking of making employees happy, one of the things that I've seen echoed across, several reviews was people talking about the flexibility that you offer there. And, I would imagine that contributes to better work-life balance. Are you seeing that it is maybe even helping in, the recruitment efforts or just retention efforts just by helping, the caregivers have more of that work-life balance in place?
Absolutely. I mean, I think when you look at the home-based services, you look at home care, there's definitely a lot more flexibility than working a 12-hour or 24-hour shift in the hospital, right? There is definitely some flexibilities built into just our business. But, you look across the board, there is a lot of competition. There are many, many companies in our space, and everyone's going after the employee pool is shrinking, and flexibility is not enough because let's be honest, we're all offering flexibility. It's really, what do you do to really have employees want to come to your company? And when they come, they want to stay with your company. I think, in the past, I remember when they started this company 10 years ago, I was walking in one of the offices in New York and had an employee come over to me and say, Isaac, this is the best place I've ever worked.
Wow.
Never leave. And that was probably my biggest compliment that I've gotten, right? Is that's when you've created an environment where people want to be.
How do you manage everyone? So everyone focuses on external communications. I think most organizations are constantly focused on external communications, but not many are ever focused on internal communications. How important is it? And how do you guys go about that?
Right. So it goes back to what I said originally. You need to make sure your employees feel valued, trusted, and heard. And in order to do that, they have to be in the loop with whatever's going on in your company. You need to be upfront with them when there are challenges, and you need to talk to them about what some of the exciting things that are coming down the pike and what's happening with the company. I think if you don't keep your employees engaged, they're not going to be bought in. And if you keep them engaged and part of the process, that's when they start feeling valued, trusted, and heard. And that's critical and crucial. I totally agree with you. There's so much time, money, and energy spent on external communication and not enough spent on internal communication. Again, if you look at it as your employee are really your key to success, then just like you're invested in external communication, you need to invest in internal communication. Again, I know it sounds simple. You want to make sure your employees feel valued, trusted, and heard. If you can accomplish that and you go in with that mindset, I think
You didn't start off years ago with 600 employees. I imagine there must have been, some challenges along the way. What are some of those challenges, and what sort of challenges do you foresee in the future, especially when it comes to maintaining, a culture?
Yeah, obviously, when you're smaller, you know the name of probably every single one of your employees. I think when we started, a couple of startups that had 2 employees working for me. And we used to talk multiple times a day. I remember calling them when we just started and say, okay, how many patients do we have in our census? 2. I would call 3 hours later. How many patients? 3. I'd call a day later. Obviously, that's been a huge challenge as you grow. Obviously, you can't keep in touch with every single employee, and you've got to figure out other ways to build that connection. It's a challenge. There's no question. As a company grows, it becomes a lot more challenging to keep that culture, but it becomes even more crucial to keep that culture because your success really hinges on your employees, like I said. So if you continue working with the employees and making them feel like this is a place they want to be, that's why we've been successful. Without our employees, we would not be here, to be honest with you. And really, we invest in marketing and we invest in advertising. I think if you invest in your employees, you'll get a bigger bang for your buck than investing in social media or investing in advertising or whatever else it might be.
That's a bold statement, and I love that. Yeah, I love that. That's a good one. For the person listening right now that's looking to maybe improve their own culture, what advice would you give them?
When I come to work every day, I think to myself, how I want to be treated and how I want to feel. And then I say to myself, the same feeling I have and the same way I want people to treat me is the way I'm going to treat others. So I think you start small and say, okay, what would I want my employer to do for me? And how would I want to be treated in the work environment? And if you go at it that way and just simple, right? Just say, is this something that I would want happen to me? Is this the way I want to be treated? And if you do that, I think, and with that mindset, you'll be successful. So it's not building these huge programs and investing a ton of money. It's based on, it's the human interaction. It's really feelings. It's, we have a very simple motto: do to others like you want done to yourself. And really, if you live by that, and that's how I've lived my life and built my company around, I think, you'll have employees that want to be there for you and want to work for you, want to go the extra mile for you. So you don't need to invest a ton of money. It's just having that personal connection and really treating others like you want to be treated.
Right. And I agree with that. In terms of investing, maybe there are some areas where you should invest, right? So let's talk about technology. Are there any technological pieces that you've maybe added to the organization that have helped to maybe enhance the caregiver's perspective or, how they interact with patients?
Absolutely. So I think, obviously it's been a extremely challenging year since obviously COVID hit. And every year we sit back and we take a look at where we want our company to go. We pride ourselves as a boutique organization that really customizes our care based on each individual patient's need at Constellation. And technology plays a huge role in what we do. And as we sat back last year, thinking about what we want to do, and we had these grand plans and how we want to utilize technology, and then COVID hit, which kind of accelerated some of the plans we had through technology. So just to give you a very basic example, our concept is a complete care at home approach, which means we want to bring everything the patient needs into their home to avoid leaving their home, to avoid going back to the emergency room. And what's happened through COVID is patients don't even want to go see their physician and they want to stay at home. And not only that, they would say, look, my therapist came today to provide PT services. We're afraid. We don't want anyone coming. So what we've done is we've really utilized telehealth, video, and we're doing virtual visits with patients. So if you don't want me coming to the home, I'll do a virtual visit. You can't see your physician, guess what? We'll patch in through a company that we started, a related company called Impact Health. We have nurse practitioners and physicians available to really video in and do, whether it's a FaceTime visit or a Zoom visit, and put eyes on the patient and say, okay, let me assess you, let me see what's going on, let me see if I need to change your meds, let me see, are you declining, what can we do differently to really avoid that potential hospitalization. But in addition to that, we had patients that refused to go to the physician, so we brought the physician to them. And that's really our concept of complete care at home, is how do we utilize technology to bring services that were traditionally provided outside the four walls of a patient's home into the patient's home. So now we're able to bring physician services, we're able to bring therapy services, and a whole host of other services into the comfort of the patient home. That's important regardless, because you want patients to be comfortable and staying at home. But especially during the pandemic, it's crucial. Think about it. You have someone that needs a physician but doesn't make it a physician. Think about what will potentially happen to that patient. And then we have some incredible heartwarming stories through our hospice program where, unfortunately, in the hospital setting, in the nursing home setting,
Right.
family were not able to visit patients. Our staff were able to go in through video visits, and we would have, one story comes to mind, where we did a virtual birthday party with a patient. We got the entire family on a virtual visit with the tablet, but at least the patient that was dying had that connection, was able to see their family. They were able to sing happy birthday for the last time. So the technology, if utilized properly, really has an incredible effect, and really has an incredible effect during the pandemic and even post the pandemic, really affecting how we provide care.
I mean, you talked about how, because of COVID and the pandemic, it sort of accelerated the implementation timeline for a lot of technology, clearly. Do you think that because maybe patient behaviors have changed, that they'll go back to the way it was before? Or you think some of these things are just going to be here to stay because people have now become accustomed to these things like telehealth?
Absolutely. I think some of these things are definitely here to stay, because if you think about it, right, no one, especially during a recovery, so you go into the hospital for a hip replacement, now you go straight home, you need therapy at home. So we at Constellation, we come in there and we provide therapy in the comfort of your own home. You can't make it to the grocery, you can't make it, it's hard to make it to the doctor, right? So I think what's happened is clients now see that, wow, there are companies out there that can come to me and I don't need to leave and wait in the waiting room and wait in long lines. That's not going anywhere. It's all about comfort, it's all about customer service, and it's all about patient experience. So I think technology enhances all of that.
Yeah. I mean, to some extent, it's almost like healthcare is come full circle, right? You've got I remember the doctor with the briefcase showing up at people's front door. And now, then it evolved to where we're all going to clinics and offices, and you're basically have created a way to deliver all of those services back at home again.
Right. And it continues to evolve, right? And technology, it's amazing how technology has evolved and what the capabilities are, and it keeps on changing so rapidly and quickly. I looked at a device the other day with a company. It's a contactless device. It sits on the patient's wall and it monitors heart rate, respiratory rates. The patient doesn't have to wear a device. It's incredible to think about what you're able to accomplish through technology, and it's only going to get better.
Are there any other technologies? That seems, I haven't even heard of that one yet. That sounds amazing. Are there any other technologies you're excited about?
I think when you look at, when you look at technology, you need to be careful because sometimes you get wowed by the fancy car, right? And sometimes, especially when you're dealing with our population,
Right.
simpler, the better, right? So, what we want to make sure patients are safely at home. So whether a patient has congestive heart failure, want to continues to be able to monitor their weight and their heart rates.
Right.
So sometimes it's just simple as having a patient go on a scale and having a Bluetooth device connected to a monitor that's able to transmit data. You don't want to make it too complicated, but at the same time, it's difficult because when you see all these shiny new tools, you want to figure out a way to implement them.
Here's a fun question, Isaac. You and me right now, we're going out to the parking lot. We're jumping in a DeLorean time machine and we're bouncing 5 years into the future. What does Constellation look like?
Oh, wow. That's a great question. My goal is really to continue to perfect and bring a complete care solution to our clients and our patients. So if I have to fast forward 5 years, I'm hoping that regardless of what a patient needs, we're able to provide that in the comfort of their own home. So, talk about, you look at today with some of the programs that are coming out, hospital at home, right? There's no reason why a patient has to go to an emergency room when they have an episode. What can we continue to bring so we can bring services so patients don't have to go to the services? So, I'm hoping that the patient continues to be at the center and we can continue to add tools and resources to make sure the patient stays in the center and the patient receives the best possible care in the comfort of their own home through a complete care solution. So if I had a crystal ball, I just hope that employees continue to feel valued, trusted, and heard. I hope that this is a company that everyone wants to work for. And I hope that anytime anyone needs care or thinks about care, they think about Constellation.
Yeah. And, with your prestigious repertoire of awards and trophy cases that you probably have everywhere, that is pretty cool. And I imagine that a lot of people want to continue to work there. So kudos to you on your leadership and the culture that you've created. A few closing questions here. If you could recommend one great book our listeners should read, which book would it be?
It's interesting. That's a great question, by the way, because there's so many great books. But I think it goes back to what I said earlier. It's not, I pick up books sometimes in the bookstore or read books that are focused specifically on culture and give you techniques how to build a culture. But it really is very simple in terms of decide what you want and how you want to be treated and how you would want your employee to treat you, and then do it to your employees and treat your employees that way. And when you read, I read biographies on inspirational leaders and how they treat others, and even, people that you wouldn't recognize on the street and are special, that you read about them and you say, wow, they went out of the way to do this. They did this. They took the time of the day to smile, or they took the time of the day to turn to their employee and say good morning, or say good afternoon, or say, how's your day going? Those are the types of books. It's not necessarily directed at culture, but it just shows you like, wow, there are so many good people in the world, and think about how good you make other people feel. And those are the books that really inspire me and inspire me with my employees.
I feel like the next book I'd like to read is the Isaac Steg book. I feel like you should have one of those in the works.
It's coming soon, hopefully.
Brilliant. I'm excited about that, and you're going to have to let me know, of course, when that book drops. Very excited. Do you have a favorite quote?
Favorite quote? I was discussing this actually with my son last night. He came back from school, and he said, "Oh, by the way, did you ever hear this quote?" And now I'm trying to remember what that quote was, because that was a really good quote. Again, it's a simple, treat others like you want to be treated yourself, right? Do to others like you want to be done to yourself. So it goes along the same lines that we've been talking about over the last 30 minutes.
Yeah, I love that. It's clear that the last year was challenging for almost everyone in different ways, potentially. What has the last year taught you personally?
Ooh. I think we need to do another podcast on that, by the way. That's a loaded question. The last year has taught me that I don't think we recognize greatness in our employees until you're faced with a challenge. Our employees have stepped up to the plate in ways that I could never have imagined. And they've done things that I could have never dreamt of. Every single one of my employees have put their patients and clients first, going out of their way to make them feel comfortable, or doing things that even if they put themselves in danger, in terms of, going into homes, being the first one to go into homes while this pandemic was raging. And I found it unbelievably, I was incredibly taken aback in a positive way how they've stepped up to the plate and really taken COVID head on. I mean, they've gone into the fire essentially and really have done things that I don't think any of us can imagine. I mean, even through some of the innovation we've done over the last year. Without them, none of this would have been possible. I am blessed to have them work and be part of this Constellation family, because without them, I don't know where we would be. So that's really the biggest lesson, is people really step up to the plate. And, I would love for people to look back and really, you see these advertisements all over the place, our healthcare heroes, they're true healthcare heroes. If people can stop and you see a healthcare hero on the street, stop and thank them and say, thank you so much, because I don't think people really appreciate what they've gone through, sacrificing their families, going out, exposing themselves, going back home. I mean, it's incredible, and I'm truly blessed to have them as part of this family.
And that speaks volumes to the culture that you've created as well. Final closing thoughts to the listener, healthcare executive, physician who's leading his own organization. What advice would you give them?
The advice I have is, you need to stay passionate. If you as a leader stays passionate and believe in what you do, it will trickle down to your employees, it will trickle down to your culture. You have to believe what you're selling. People, I can tell you, you can see it with kids, right? If you're bluffing, they see right through it. If you want your employees to buy into it, you truly have to buy into it. Understand what you want the culture to be like, understand what you want your employees to feel like, and then believe in that. If you believe in it, it will trickle down and it will affect your employees. If you don't believe in it, no one's going to buy into it.
Thank you for joining us on the Healthcare CEO Show. If you've enjoyed this episode, don't forget to subscribe on your favorite podcast platform for more insights from the top. Until next time, lead boldly and care deeply. See you on the next episode.